Muchas gracias por la invitación. Estoy muy contenta de estar en este evento que reúne innovadores a quienes yo admiro mucho. Y hoy día les voy a presentar acerca de mamás del río. So, in rural areas of the Peruvian Amazon, there are 4 times more neonatal mortality and 2 times higher maternal mortality than in the rest of its territory. And the majority of these deaths occur due to preventable causes. In Loreto, the region where we operate in the Peruvian Amazon, there are 55% of underreporting of newborn deaths. And this happens because when a baby gets sick, the family decides not to take them to the health post because it's a trip by river that is expensive, distant, and dangerous. Instead, they decide to stay at home. And if the baby dies, he gets buried at this local cemetery. And this newborn didn't have even the option to get an identification card. So it's like if this death never existed. This high mortality is related to the high percentage of women who deliver at home, that according to our publication that we released this year on Lancet, gets to 50%. So around 70% of women in these areas deliver at home, 7 out of 10 women. And of these women, 93% deliver without the care of any trained healthcare provider. These deliveries occur in the floor, without skin-to-skin contact or early breastfeeding, and with more than 50% of women who throw up the colostrum because they think it can harm the baby. I was able to witness this reality when, as a medical epidemiologist, I was doing research on infectious diseases in the Peruvian Amazon. At this time, I got pregnant with Silvana, who is in the picture, and then with Ariana. And experiencing my maternity in the Amazon allowed me to not only see, but also feel more intensively the huge gap in access to healthcare that women and their families face in these areas. So because of this, I decided to commit my work to improve maternal and newborn health, remote, rural, and indigenous areas in the Amazon. And at that time, I received a call from applications from Grand Challenges Canada and the Peruvian Council of Science and Technology. And actually, they were looking for bold ideas. So I decided to submit a grant application. And when I had to type the name of the application, I immediately thought on Mamás del Río, or Mothers of the River, because it reminded me the mothers that waited for us along the banks of the Amazon River in Loreto. We got the grant, and this is how Mamás del Río started in 2015. So what do we do in Mamás del Río? Mamás del Río aims to improve maternal and infant health in remote, rural, and indigenous areas in the Amazon. And what we do is train community health workers, who are people from the community who empower with a tablet that has an application, conduct home visits to pregnant women and newborns. And what they do is deliver content in the form of pictures and videos that have been created with the community. And they provide education to the families, education that can make a difference between life and death. And also, the community health workers gather health data through the tablets that can be later sent to decision makers. We also train traditional attendants, healthcare personnel, and we provide community sensitization about the importance of caring for the health of women and children. We started Mamás del Río in 13 communities as a pilot in Parinari, in Loreto, and then, thanks to the same funders, Grand Challenges Canada and the Peruvian Council of Science and Technology, we expanded to 84 communities along 3 major rivers in Loreto, along 350 kilometers of river extension. At this time, we were able to do an evaluation of the program during 3 years, and we found, and this will be soon released on Lancet, it's already in press, we found that Mamás del Río was able to improve almost all essential newborn care practices around thermal care, breastfeeding, and cord care. And very importantly, Mamás del Río also improve institutional deliveries. So thanks to the good reception of the program, the Ministry of External Affairs of Peru and Colombia and the Inter-American Development Bank funded the program to the border with Colombia. And this is how Mamás de la Frontera, that you see here, was born. And in this case, Mamás del Río is unifying two countries, Peru and Colombia, through health. In Mamás de la Frontera, we are operating along the Putumayo River, along 400 kilometer extension of river. And the good news is that 2 weeks ago, we launched the second phase of Mamás de la Frontera, thanks to additional funding from the Ministry of Foreign Affairs of Peru, Colombia, and the Inter-American Development Bank. And this time, we are increasing our area of operation to 45 communities, and the community health workers will provide additional activities. For example, they will not only follow pregnant women and newborns, but they will follow children until they are 1 year old to promote vaccination, anemia prevention, and parenting without violence. They also will work on promote family planning and the prevention of violence against women. We know that Mamás del Río works. It's not an idea. Our program has generated scientific evidence of its effectiveness. We have received numerous awards, includes the Social Innovation in Health Award by the Pan American Health Organization. We were also selected this year to represent Latin America in the annual conference of the TDR program of WHO in Geneva. And although receiving awards and recognition is very satisfying because it tells you that you are on the right path, actually, it's not enough. We need Mamás del Río to be implemented as a public policy in Peru. And for this, we need an intervention that includes political, community, and media advocacy, because changing the life of a mother, a newborn, and an entire community is within your reach, is within our reach. Thank you very much.